Good afternoon, Rochester community, and welcome to our lunchtime conversation. We have the University of Rochester medical team here, and we also have our Rochester City School District experts for our parent panel during our lunchtime hour. At this time, I'd like to introduce our Rochester City School District staff who will be supporting the panel discussion. First, we have Ms. Elizabeth Reyes, who is the Executive Director of Equity and Social Emotional Learning. Next, we have Ms. Erin Groutman, who is the School Health Coordinator for the Rochester City School District. And then we have Ms. Stacy Darby, the Coordinator of Environmental Safety. Please join me on the screen. And next we have Ricky Frazier, who is our volunteer coordinator and planner of this wonderful event. I'd also like to introduce our Director of Community and Parent Engagement, the lovely Ms. Khadijah Muhammad. We also have Mr. Mike Schmidt, who is the Chief of Fiscal and Plant Operations for our entire Rochester City School District. You could please join me. And at this time, I'd like to turn it over to Dr. Andrea Migliani, who is an emergency medicine medical director and doctor for the University of Rochester Medicine. Please join me. Thank you.
Thanks for that introduction. I actually have a few more team members that I'm going to bring on board, all of which are from the Emergency Department, the Department of Emergency Medicine from Strong Memorial Hospital with the University of Rochester. First person I'd like to introduce is Kim Benway. Kim is the nurse manager for our PEDS ED. She started out as an elementary school teacher, and in 2012, she went to the medical field, and she joined us in the emergency department in 2015. As I mentioned, she's currently the nurse manager for our PEDS emergency department at Strong Memorial Hospital. I'd also like to introduce Dr. Courtney Jones. Dr. Jones is an epidemiologist. She has over 10 years of experience conducting large-scale research studies. She's very well embedded in the research division at University of Rochester, specifically within the emergency department. And she grew up in the city of Rochester, actually. She has two kids, ages 7 and 10, and we are very happy to have her as part of our department. I'd also like to introduce Dr. Elizabeth Murray. She is a PEDS emergency medicine physician at Golisano Children's Hospital. She also grew up in Rochester. She got her medical degree from the University of New England in Maine. She came to the U of R to complete her training and has been here ever since, and we're very lucky to have her. She also practices at the local REACH clinic that partners with Bivona Child Advocacy Center, and she's a spokesperson for the American Academy of Pediatrics. She's also the pediatric medical expert for Good Day Rochester. I'd also like to introduce Dr. Flavia Nobe. She received her undergraduate training at UC Berkeley and her medical degree from UC San Diego, and she completed her residency training in emergency medicine at Highland Hospital in Oakland, California. Luckily, in 2006, she made the big move from the West Coast to the East Coast and joined us here in Rochester, and we're lucky to have her as a physician in the emergency department. She is also the Associate Dean of Admissions for the University of Rochester School of Medicine and Dentistry, so she has a very large job as well. And last, but certainly not least, I want to introduce Shantae Washington. She is a graduate of RCSD class of 1996 from Edison Tech. In the year 2000, she started her career at Strong Hospital in the emergency department. She started as a registration associate, then she was patient care tech, and with each promotion, her goal was always to become a nurse. She attended classes at the Rochester Educational Opportunity Center, REOC, and she got her degree as a licensed practical nurse. While she was working clinically, she continued her education. She got her associate's degree as a registered nurse from FLCC. She got a bachelor's degree in nursing from Brockport University and a master's of science in nursing leadership and administration from Roberts Wesleyan College in 2017. So she also is very much a local girl. Shantae worked in the ED at Strong Memorial Hospital for about 20 years, and she was a nurse manager of the ED observation unit. Currently, she's actually the director of nursing services over at Highland Hospital, which includes the emergency department, the family maternity center, medical observation unit, medical imaging, and 9 ambulatory clinics. In other words, she has no free time. Thanks for having all of us.
Thank you.
Dr. Magani, you forgot one important thing. I'm an alumni of Edison Tech.
I mentioned that was my first line.
I didn't hear that.
That was my first line. No,
Sorry.
I know that that's the most important thing.
That's the most important out of all of that.
Well, we are definitely grateful to have all of this expertise in the room, especially having a former RCSD graduate. I am also a former RCSD graduate, and we have a couple of other former RSD graduates that are here with us today. So thank you for those introductions, Dr. Miglani. My name is Khadija Mohammed. Again, I'm the director for the Office of Parent Engagement. Want to definitely thank our community, our parents, our students, staff, and our URMC staff for joining us this afternoon. And we want to go ahead and get right into those questions. School has reopened. We have completed our phases of reopening and have kids in our buildings for all grades, levels. And the biggest expertise that we don't currently have on our screen is our parents. So a lot of these questions have come from our parents just wanting to get a clear understanding of, the risks of COVID and some of the safeguards and measures that they can take so that our kids can remain safely in our school buildings. So I will start with the first question, and this may be an obvious one and sometimes it's not. What is the best way to wear a mask? What is the best mask to wear?
I'm going to ask Dr. Nobe to see if she can answer that one, please.
Thank you for asking, and it's a fantastic question, and it's not always obvious. There are a lot of choices out there. I'm not going to tell you which mask to wear, but what I am going to tell you is what you shouldn't have in a mask. So we're going to eliminate things. So every mask that you have should have at least 2 layers of washable, breathable fabric, or one that's disposable, such as the paper masks that you see a lot of doctors and surgeons wearing that are available at supermarkets, Costco, Walmart, Wegmans, and etc. The mask should cover your nose and your mouth. If the mask does not fit properly over your nose and the mouth, it does not work. The mask should also fit against the sides of your face and not have significant gaps. So there are a lot of fabric masks that sag, or masks that are significantly old that sag. Those gaps allow the virus to extrude. And then the mask ideally will have a wire to prevent leakage over the top of the mask, over the nose. So that way you have closure over the nose, around the sides, and over your nose and your mouth. Please do not choose masks that are fabric that makes it hard to breathe. You should not have an exhalation valve. There's some masks with little valves that allow virus to spew out. And masks obviously should not be worn for anybody below 2 years old. If you're going to wear a gaiter, the gaiter should be doubled up over your nose and your mouth. Kids have masks that are made for their face sizes. Putting an adult mask on a child with a smaller face will allow a lot of virus to come out into the atmosphere. Not good. And putting a mask that is for a child on an adult will not allow for it to cover over the nose and the mouth. Again, fit really matters. Making sure it covers your nose, the side of your mouth, over your nose, and over your lips and under your chin is ideal.
Very, very thorough answer to that question. And again, sometimes you think that's just more of an obvious question, and it's certainly not what we have just heard. So thank you very much for that feedback. Next question. How often should you take a COVID test?
I will answer that one as well. COVID tests tell you if you have the virus right now. There are 3 ways that test can be somewhat wrong if you actually have, there are three caveats to that. One, you don't have COVID at this time at all, and the test will be negative. You've had very, 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 very early COVID, so the test isn't designed to pick that information up. Or three, the test was incorrect. If you have symptoms and your COVID test was negative, you should quarantine and get retested in between 3 and 5 days from the onset of the last negative test. If you have no symptoms, you don't need to get tested unless you've been exposed or in close proximity to somebody with COVID. This is conflicting and confusing. Our quarantine time in Monroe County is 10 days. If you have symptoms and your test is negative, you can retest in 3 to 5 days. If you have symptoms and your test is negative after 10 days of quarantine, you do not need to retest. Does that make sense? Or is that, it's very complicated. That is, whoever asked that question, that is not an easy question to answer. Liz, would you put in anything else besides that?
Yeah, I guess I would just add too that if you are told that you've been exposed and you were just exposed yesterday, getting a test right away might not be helpful because it takes some time for your body, if you're developing the infection, to actually develop the infection. And I know that sounds kind of strange to say, but your body needs some time for those germs to build up, and so to a level that we can test it. So you could be falsely reassured if you're exposed to somebody today, you get tested tomorrow and it's negative. It could just be that it's too early. One of those kind of caveats that Dr. Nobai mentioned. So waiting 3 to 5 days after exposure can be helpful. You are still needing to quarantine during that time. And those are the rules as of today. And it is super complicated. So it is a really good question to ask and to talk about because this information changes a lot.
The vast majority of people will be positive between 5 and 10 days after exposure. And that's why we have that quarantine period of between 10 and 14 days.
I mean, the fact of the matter is if you have symptoms, you should be quarantining as well, sort of regardless of your test results. And the other piece of it too is it's really hard to figure out what defines an exposure. And I think tapping your primary care physicians, your pediatricians, we get that question really often in the emergency department. I'm not sure if I was exposed. Some people just go to Wegmans and they saw someone without a mask and they're not sure if they were exposed. I think exposure is defined a little bit differently along the way. The best advice though is to protect yourselves and make sure you're wearing a mask as appropriately as often as you can. And if you're not feeling well, stay home.
Okay, Dr. Biglani, just a follow up to what you just said, as far as exposure goes, can you just review what exactly that means in regards to exposure?
Sure. So I can tell you what we consider an exposure in the emergency department and in terms of what we would consider either a staff exposure or a patient exposure. And what that means is someone who was COVID positive that was very clear, and both parties had their mask down or were inappropriately wearing their mask and were in close proximity with each other. So, for example, if I'm in a room taking care of a patient and I have, I'm wearing my mask like a chin strap, and it turns out that even if the patient was wearing a mask and they weren't wearing it appropriately, if they're coughing, that's an exposure. And the other thing that we included in the emergency department is eye protection as well, but that's not something that's necessary in terms of necessarily required out in the world also. So that's how we define an exposure. When we have a patient that was exposed based on chart review, we actually call any patient that may have been exposed that came through the emergency department. What's changed a little bit is that not every single person that has an exposure is required to have a test according to the CDC at this point. It just depends on what their other risk factors are, and most importantly, if they have symptoms.
So traditionally, exposure also implies, a significant exposure implies 15 minutes of contact within 6 feet of somebody with COVID, right? That is a really scary exposure that increases your chance of having COVID. Hugging, sharing food utensils, kissing people, intimate contact, that is all considered exposures. Walking by somebody with COVID in an outdoor setting certainly increases your risk from nothing to a little bit, but we worry less about those types of exposures. So within 6 feet for greater than 15 minutes is considered a serious or significant exposure. Taking care of anybody with COVID, having intimacy, hugging, kissing anybody with COVID, sharing food and utensils, COVID exposures.
Thank you so much for those answers. How do you know the difference between a cold, allergies, and COVID-19 symptoms?
Shantae, do you mind fielding that?
I can take that. I'm so sorry. Can you guys hear my the background noise? Okay, perfect. I thought it was gonna be horrible for you guys to hear me. But so the difference between allergies and COVID is they're very, 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 very similar. The one symptom that stands out for COVID that not so much for seasonal allergies would be a fever. But honestly, the only way to know whether you have COVID versus allergies is to get a COVID test. The symptoms they mirror each other so drastically that really ultimately is the only way to determine COVID versus seasonal allergies.
Thank you so much.
You're welcome.
We're going to switch gears just a little bit and go to some questions for our RCSD staff. The first question is, what routines do students go through when entering school buildings?
Sure, I can start with that one. Hi, everyone. Welcome. Thank you for joining us. When students arrive, first of all, let's start with the bus. If a student comes to the bus and doesn't have a mask for any reason, or if the mask they're wearing doesn't fit the guidelines for masks on site, which are ones just like, I forgot who was talking about it earlier. I'm sorry. One of the doctors talked about it just a few minutes ago. Covers the mouth and nose, covers the chin, fits well, doesn't have an exhalation valve, and is not a gaiter. If someone came with the wrong mask, they'd be provided with a paper mask. That starts right at the bus. They'd sit on the bus. Once they arrive to school, they go through a fever screener, and that would either be with a hand device that the students stick their hands right underneath. Staff do this as well. They'd have their temperature taken that way, or there are handheld thermometers that are used as well to make sure that we can get everyone into the building. If someone was identified as having a fever or not feeling well during that screening, they would be reevaluated by the nurse.
Thank you, Stacy. And just to follow up to that, it is a question that is within our document. What is the procedure when a student gets sick in school?
I can take that one. Good afternoon, everyone. So if a student gets sick in school, we are trying to avoid them going to the nurse's office. So we would ask the teacher to call the nurse. The nurse would go up to the classroom and escort that student to the isolation room, which is just a room where there's no other students in that room, right? It's got better ventilation and there's space where the student can be apart from anyone else. And we would ask the parent to come pick that student up. In that situation, we would ask that student if they had symptoms of COVID to get a COVID test before they returned and to see their physician.
Thank you, Erin. So we have a couple of questions. As you guys know, we are live streaming. Have a couple of questions coming from Facebook and YouTube, and I want to make sure I incorporate those as well. Is there any discussion about children or teens getting vaccinated?
Dr. Jones, do you mind taking that?
Yeah, of course. Hi, everyone. Thanks for listening in. So currently, there's one vaccine that is currently approved for children ages 16 and 17, and that is the Pfizer vaccine, which has approval for the 16 and 17-year-olds. In New York State, if you are a 16 and 17-year-old, you can currently get the Pfizer vaccine if you have a serious sort of medical pre-existing condition. And those vaccines are being given at 2 locations within Monroe County, the Hawkeye site and the Dome. But again, those are only for 16 and 17-year-olds who have a serious medical condition. The other two vaccines that are currently available are not approved for use in children under the age of 18. However, there is ongoing research that is sort of near completion for children ages 12 and older, and they are discussing the conduct of research for children 12 and under. So right now it's limited to that 16 and 17-year-old age group, and that's just for the Pfizer vaccine. And again, in New York State, if you have a child in that 16 to 17-year-old age group with a serious medical condition, they would be eligible to receive the vaccine. But I don't know, Dr. Murray may have something she may want to add to that as well.
Yeah, a couple other really important points is that we treat it kind of just like the flu vaccine. So parental consent is still needed. So a parent would still need to be there and go through the information and consent to their child having the vaccine. If you Google Golisano Children's Hospital COVID-19, a web page will come up that has the list of all of the different medical conditions, but it can range from moderate to severe asthma, chronic kidney disease, sickle cell, things like that. If your child sees a specialist within the University of Rochester system, you probably would have already received an email saying that your child qualifies, but we know that only about 40% of the emails that went out have been opened and looked at. So we could have had some bad email addresses. So if you're wondering if your child qualifies, information is available online, or certainly you can reach out to your child's physician. But as Dr. Jones said, that's the Hawkeye site and the Dome site. If you have a 16 or 17-year-old that is employed in one of the jobs that currently qualify for vaccination, they too can get the vaccine. So they can be healthy and happen to be maybe working at a grocery store or one of the approved industries, they can get the vaccine. But again, it has to be the Pfizer.
If you go on the New York State COVID-19 website, there is an Am I Eligible button, and that'll actually, the first thing you have to put in is your date of birth, and that'll actually walk you through whether or not whoever you're registering, be it your child or yourself or someone else or a parent or a neighbor, they can walk you through sort of what are the eligible comorbidities or other conditions or health conditions, are you an essential worker, and everything else. And part of that will take you directly to scheduling. Again, Hawkeye site and Dome site, I think the Hawkeye site has appointments right now as early as next week still. I think the Dome is scheduling early April, but they also have appointments, at least as of last evening. I know the appointments are going quickly, but it's sort of all in one at that point. But reaching out to your physician if you have questions is helpful.
Thank you. And here's a follow-up question for Dr. Jones in regards to the vaccine. What's the major difference between the Johnson & Johnson, the Moderna, and the Pfizer vaccine?
That is a fantastic question. It's a little bit complicated, so let me try and explain sort of the similarities and the differences across those three vaccines. So you're right, there's currently 3 vaccines that have received sort of emergency use approval in the United States. The first 2 are the Moderna and the Pfizer. Those were approved in late 2020. And they're very similar in terms of their design, administration, and how well they work. These 2 vaccines work a little bit differently than some vaccines we might be familiar with, like the flu vaccine. So the flu vaccine and others that we traditionally receive often use what we call like an inactive version of the virus to sort of tell your body and your immune system how to respond and fight off infection. The Moderna and Pfizer vaccines both use a different type of technology called messenger RNA. And I don't want to get too scientific here, but I'll try and explain it a little bit. So messenger RNA, it's been studied for a number of years for different types of infections and for the potential development of vaccines. And it's essentially, you can think of it like a recipe or a set of instructions that tell your body how to make a specific type of protein. And it's that protein that helps your body and your immune system protect you from COVID infection. And it's important to note that this messenger RNA, those instructions, it's incredibly delicate and it doesn't stay in your body very long. So once sort of you receive the vaccine, the messenger RNA is delivered to your body reads that set of instructions, and then it sort of self-destructs within 2 to 3 days. So I've kind of explained it to my children. I have a 10-year-old, and I kind of explained it to him as almost like a Snapchat message. It's you read it and it sort of self-destructs. And so once it sort of, your body receives the vaccine, it reads the instructions, it makes that protein, and it's that protein that really helps your body respond and protect you from COVID. The other vaccine that is the most recently approved one is by Johnson & Johnson. This vaccine also uses a different technology from both the sort of traditional flu vaccine and the messenger RNA vaccines by Pfizer and Moderna. This one is sort of a combination of a common cold virus that's been altered a little bit. It can't make you sick, it cannot make you ill, cannot make you sick, and it also has instructions to make that same protein that helps protect you from getting COVID. It just does it in a slightly different way. So the Pfizer and Moderna vaccine, they both require storage in really cold temperatures because that messenger RNA is so delicate. Whereas the Johnson & Johnson vaccine can be stored like in traditional refrigeration. So the Johnson & Johnson vaccine can be sort of distributed more broadly because some of the refrigeration requirements for Pfizer and Moderna vaccine are a little bit more limited because it has to be stored at such cold temperatures. The other primary difference is the Pfizer and Moderna vaccine require 2 doses separated by a period of a few weeks, whereas the Johnson & Johnson vaccine only requires 1 dose. And all 3 of these vaccines are incredibly effective at preventing COVID infection, severe COVID infection that might result in hospitalization and death from COVID. So they all have like really, really fantastic efficacy and how well they work to protect us against COVID.
Thank you so much. And as a follow-up, Dr. McNaney, how soon will the Johnson & Johnson vaccine be available in Rochester?
So, you know, I think unknown still. Oh, I'm sorry. No, that actually changed really recently. I think we're starting to distribute the Johnson & Johnson. I apologize.
Yeah, it's in New York State.
Yep, it's in New York State now. And so it's all based on availability of it more than anything else. So we are distributing the J&J vaccine at this point, along with Moderna and along with Pfizer. Where you're getting appointments, places cannot make appointments until they have the vaccine available. So the vaccine getting shipped centrally and it's getting distributed by New York State as well. So when the appointments are available, that's when we know we have the vaccine on site. I will say that there still isn't much by way of choice of which vaccine that are associated with these appointments. So one of the questions that we'll get often is, I'd like to get this specific vaccine when I make that appointment, unless it's prohibited by age. So Pfizer is the only one that 16 and 17-year-olds can get. There still isn't the ability to choose which vaccine to get at this point.
Thank you. That is important information. I think we've had some questions just out there in the air as far as which vaccine will be available when our community members are making those appointments. So the next question is from a parent that they said, I've known someone who got sick after the second vaccine. Does this happen a lot? And this would be for Dr. Washington.
I wish I was a doctor.
I'm sorry.
That's okay. That's all right. Well, yes, it is very common for someone to not feel well after receiving their second dose. I want to note that the immune response that an individual experiences after the second dose is drastically lighter than if you were to contract the virus. So you get your second dose for a period of 12 to maybe 48 hours. You may not feel well. You may have a slight fever. You're very fatigued. Mild symptoms, say, you may experience after your second dose, and that's normal. I want to put that out there, that is normal. That just your body is doing what it's supposed to do. You will not experience, well, so far to my knowledge, no one has experienced any hospitalizations or severe illness and or death after receiving their second dose of vaccinations.
May I just say, only 40% of people will have any symptoms besides a sore arm after receiving Moderna or Pfizer. We don't know about Johnson & Johnson's yet. So the majority of people do just fine, except for a little bit of a sore arm, just like any other vaccine. And these symptoms are treated with Tylenol, just regular medications. and a little bit of rest.
I think it's also important to point out that even after the second dose, it takes a few weeks for your body to build up immunity to really be protective against COVID-19. So 2 to 3 weeks after your second dose is when those lines in the graph really suddenly started to split, and the people who got the vaccine clearly had more protection than those who didn't get it. But that's 2 to 3 weeks after the second dose of the vaccine. So nothing's 100%. Is it absolutely impossible to catch COVID after you get the vaccine? No, but it makes it much less likely, and it also makes it a lot less likely that you're going to become severely ill.
But I also think that we should also note that even after you've been fully vaccinated, you still have to wear your mask, wash your hands often, social distance, and adhere to the guidelines that the experts have in place to keep us all safe. Because as Dr. Maglani said, we're not protected 100%. You absolutely can still contract the virus. Obviously, it will be much milder, but you can transmit it to others. So we need to be very careful still.
And I think this is a perfect point to jump in on and identify or remove the stigma that the vaccine does not give you COVID. If you get symptoms that mimic the virus, your body's doing the right thing, as we had said earlier. But I do know that there have been some questions that we've received within our department that, if you have the symptoms after either vaccine, whether first, second, or both, that is a normal response. Your body's doing what it's supposed to do in a sense of being trained to actually fight this virus if you do get exposed or if you get sick with COVID. As Dr. Maglani said, nothing's 100%, but the vaccine itself does not give you the virus.
Thank you. Next question. Is the UK strand still a concern in New York State? Dr. Jones?
Yeah, I can take that one. That's another fantastic question. So I first want to say that the information that we have about the different variants for COVID is changing on a day-to-day basis. So we're learning a lot about these variants, and there's a few of them. But overall, I think we should be concerned about these variants, and there's really two reasons why. So the first is that the majority of our community is still at risk for getting COVID infection, either because they were never infected with it and became ill sort of naturally, or because they haven't received a vaccine. So much of our community is still susceptible to COVID infection or still at risk for getting COVID. And so the second reason why we should be concerned about these variants is that they appear to be more infectious and spread more quickly than the original version of COVID. So that means that it has the potential to sort of spread throughout our community really quickly. And so this is true for the three primary variants that we are monitoring. So that includes the UK variant, the Brazilian, and the South African. All three of these have been found in the United States. The UK is thought to be the most common one in the United States, but all three are present. There are numerous other sort of smaller mutations that are sort of being tracked on a day-to-day basis. They do remain a concern until our population is, sufficiently vaccinated or immune. It's something that doctors and scientists, throughout the country and locally are monitoring very, very closely on a day-to-day basis.
Thank you. The next question. Do kids show different COVID symptoms than adults? Dr. Murray?
Sometimes, maybe kind of. We know that teenagers, because they kind of physically are pretty similar to adults, right? A lot of their symptoms are very, very similar. Sometimes the younger kids will have a lot more stomach aches and GI symptoms, and not so much the cough, cold, loss of smell situation, but that notorious loss of smell can definitely still happen with kids. One thing that we need to really remember is that even though kids can get this germ and definitely have COVID-19, in general, we are so grateful that children in general do not get as sick as adults. However, they still do get sick and they can still transmit the infection to other people. The one thing that's really important to remember that's special about kids is kids seem to be the only part of our population that have this after effect, this kind of late couple weeks after COVID, they had this secondary event that happens. We call it MISC. And so it's this kind of, your body kind of has a reaction. Some people didn't even know they had COVID, though most did, where the kids all of a sudden will get really sick with fevers, really bad belly aches, maybe diarrhea, a rash, really, really down for the count. Not just kind of, oh, I wonder if my child's sick. Like, they are clearly really sick and they get sick fast. This phenomenon is only happening in kids. Average age is about 8, but we can see it in younger kids and we can see it in teenagers as well. So even though we're kind of in a situation where kids don't necessarily in general get as sick from COVID itself, they have the risk of this side effect down the road. So making sure that our kids are continuing to do a great job with wearing masks and good hand hygiene and following all of the guidance is really, really helpful, because we want to make sure we don't put them at risk for having this other side effect down the road.
Thank you, Dr. Murray. Our next question is from YouTube for the Rochester City School District. Why did RCSD decide to stop random testing?
I can answer that one. So the random testing was done under the guidance of New York State. At the time that the random testing was done, we were in different colored zones, which required us to test a certain percentage of our school population. Since the transmission in our community has lowered, we are no longer under that zone, so we no longer are instructed by the state to test.
Thank you, Erin. And for RCSD again, how many rooms are there going to be in each school? Isolation rooms does each school have?
So right now, each school has one isolation room. As you know, our population of who is coming to school is much lower than normal. If we were to need more, we would certainly have more isolation rooms, but right now that's adequate.
One more question for our RCSD staff. Why doesn't the district use via email or text pre-screening for hybrid students?
So the reason that we're not using the pre-screen tool, we are sending out a robocall to all of our families weekly, asking them to do the pre-screening. We are hesitant to send out an app because we don't think all of our families can receive those apps and respond to them. That is the reason we're doing that right now. We are looking at different technology for next year that will meet the needs of all of our parents.
Thank you, Erin. This question is for Dr. Murray. Can you explain the travel restrictions for New York State residents that have taken the vaccine?
I can tell you what they are. I don't know if I can explain them. So it's changing moment by moment. But as of today, for people who have received both doses of their vaccine, they don't need to follow the same quarantine and testing rules that we've had very recently. If you remain unvaccinated and you leave the state, you are following the same guidelines as before. But what this means for the people who've been fully vaccinated, if they leave the state, they don't have to do the quarantining and the testing as they had to before. This, though, the one thing that's really important, and I think this is going to change pretty quickly as we are able to monitor so many hundreds of thousands, actually millions of people that have been vaccinated. Right now, the rule is that you qualify for the lack of quarantine, lack of testing if you are within 90 days of your second vaccine. So beyond that, they still want you to quarantine and test. But like I said, I'm pretty sure that's going to start to change soon as we continue to monitor people that have been vaccinated to ensure that the immunity is lasting a very long time. It's also, I think, really important to make sure if you are traveling, to look at the rules of the place where you're going, because lots of states have all sorts of different rules too. And so even though you might not qualify for quarantine and stuff here, you might in the place where you are going. So a lot of thought has to go into the benefits of traveling right now.
And even if you did get the vaccine, if you're deciding to travel, you still have to make sure you're wearing a mask and being careful. And again, this is one of those things, like Dr. Murray pointed out, it's changing almost, for a while it was changing hourly, and now it's daily. It'll go back to hourly, I'm sure. So just, universal precautions is important.
So in line with universal precautions, say if we're not traveling and we want to do a staycation, the question is it safe for my family to eat in restaurants?
I think, and that's a tricky one too, because, you know, safe can mean different things to different people. And that's kind of where we are with understanding and dealing with COVID-19 right now. We kind of call it risk mitigation, meaning we have to look at everything we do and kind of look at the pluses and the minuses, and knowing that we're never going to be at a point of zero risk. Coronavirus is here, and so we're never going to be at zero risk. But there's a lot of things we can do to make everything much safer for us and for our family. So if you are considering going out to a restaurant and actually dining in the restaurant, you need to take a look at who's in your family. What are the risk factors for illness of the people in your family? What is the restaurant like as far as how many tables are there? Are they really spacing everything out? Is it a super crowded, packed night? Understanding that they have to limit the number of people that are in there. But if it's a Tuesday night and there's only one other family in there, that's going to be less risky than if every allowable table is full. So it's hard to say a yes, no, but I will say this, that we've seen a lot of restaurants kind of create these outdoor igloo things. And so, you know, if you are dining only with members of your own household, meaning the people you're around all of the time anyways, that is going to be safer than if you are joining up with other families or other people from another household. So if you go to a place and they say, we can seat you outside in one of these igloo things, basically, if you're outside, but they've got you in a structure that makes you feel like you're inside, you're still inside. That's not, it's how these little igloo things are not helping. You're still in essence inside, because remember those guidelines we talked about early on about the less than 6 feet, having your mask off more than 15 minutes, poor ventilation, all of those things are still going to apply. So if you're with your own family or the people you're around all of the time, you've got a relatively healthy family, you feel that the risks are relatively low for your family, it's something you can consider, but we're still at a point where nothing is going to be zero risk.
I really want to emphasize the word ventilation. Ventilation is so key in the risk and transmission of this disease. And that's why being outdoors is so much more preferable to being indoors. If there is significant ventilation in the restaurant, it may be very helpful for you to consider doors open, how much air is moving in there versus a closed, tight, tiny space with a lot of just air being recirculated.
So keeping in mind with just safety precautions and steps that we can take to keep ourselves safe, Mrs. Benway, do we need to wear 2 masks, and is hand sanitizer safe for kids?
Hand sanitizer is definitely safe for children to use, and we do recommend it. I think that kids are really adapting pretty well to these guidelines, and they almost get excited about, you know, following the rules and using it that way. There has been some literature on double masking. As for the right thing to do, I will ask my colleagues for help there. But as for hand sanitizer, safe with children, yes. You're going to want to look at, you know, obviously what's in it just to make sure based on allergies, sensitivity of skin, as there is such a wide variety of which ones that you can purchase now, whether it's homemade, whether there's different ingredients than what we're normally used to if we were to just go and buy a generic hand sanitizer that we would have in the past. So keeping an eye out for that, but it's definitely safe for them to do and suggested.
Yeah, is anybody else's kid calling it Sanitizer? I have a 4-year-old and she calls it Sanitizer. Just blends it all together.
Yeah, Sanitizer.
Sanitizer. Yeah. I think for kids, you know, the mask stuff is tricky. And so as Kim mentioned, you know, there's information about, you know, could 2 masks be better? I think the key point is wearing 1 mask well is still going to be better than 2 ill-fitting masks. If 2 masks for a lot of people who kind of have smaller faces, but not small enough to wear a child mask, having that second mask kind of helps with a more snug fit. And so that can be beneficial. But for kids, usually you can get a mask that fits them just right and it's not frustrating to them. So 1 mask is probably going to be fine for them to do.
And a lot of the masks that we're seeing now have 2 layers. And I think that answers that question for that desire, that need that a lot of people might have too.
Thank you. So switching gears back to our RCSD staff, as the weather gets warmer, how do we make sure kids are safe outside on the playground?
I can take that one. As it was mentioned, outside is a much safer place inherently just because of the increased ventilation. Kids, when they're playing outside, will still be masked when they're playing. They will have opportunities for mask breaks outside, but when they're taking a mask break, they would be at least 6 feet apart from each other, and that mask break would be limited. They wouldn't be running around and playing during that time. They'd be doing a quiet activity. And then once they are outside and masked, that 6 feet social distance is still being encouraged. But just like one of the physicians said earlier, kind of like that quick pass by, like, oh, I'm going past you to go to the slide and I'm going past you to go to the swing, isn't the interactions that we're going to see that's going to be a high risk situation. And then we're going to be making sure kids' hands are clean going out. So making sure their hands are sanitized and clean, and then clean coming in. And there's also hand sanitizer available when they're outside playing as well. So that's all the kind of components to make sure the kids are safe when they're outside.
And Stacy, just to follow up to that, we talked about inside, and you definitely gave us a lot of information around that. So in turn, going inside, what safety precautions are taken in sports and gym classes?
Sure. So there are two separate components, right? So for PE or anything with PE, an activity that raises the heart rate and gets kids or adults, for that matter, breathing heavy inside of a PE class, they have to be spaced 12 feet apart instead of 6, and they would still be wearing their masks as well for those activities. Again, mask break could be given if it's needed. If a child, needs to do that, they're going to be spaced away. They can take a drink. Those opportunities would be offered, but they'd be offered in a way that making sure that they're safe. Sports are a little bit different in that the 12-foot or even 6-foot requirement isn't there all of the time, right? So when they're practicing and they can be spaced apart, they will be. But when you're participating in certain sports, you can't be spaced apart. They also are masked at all times during their sport, provided that sport doesn't provide a bigger risk with the mask on. So for example, the American Academy of Pediatrics came out with their recommendations, and that's what we follow at the district. So if someone is wrestling, cheerleading, swimming, diving, gymnastics, I think are the 5, someone can correct me if I'm wrong, that they wouldn't be able to do those with a mask on only while they're involved in that specific activity. All the rest of the time, training, anything like that, they would have their mask on. And then all of our other sports are played masked the entire time.
Thank you, Stacy. A question from YouTube. The question is central office still working remotely? Mr. Schmidt?
Yes, hi, good afternoon, everyone. Thank you for the opportunity. So right now our central offices are open. We've actually been open now for the past number of weeks. Our placement office especially, and any office where the community would need to interface with the school district is open here in the building. I think there are certainly some individuals that are still kind of balancing or working remotely and coming into the office, but for 90% of us, we're here. And I think if you can see, I'm actually in my office now. Erin is in her area now. Khadijah's here. So I don't feel like I've ever not been in the office, to be honest with you. I think I've been here right through March, since March 13th. But yes, we're fully up and operational.
Thank you, Mr. Schmidt. Another question for our RCSD staff. The recent breakout at School 29 was frightening. The question is, why not test students randomly after that incident?
So I can take that one. In the days after that incident, we did offer testing for staff and students. We did not get, I think we only had one family take advantage of that and come in for testing. We did test several staff members for that incident, and I just wanted to point out that that incident at School 29 did not involve any students. So that was only staff that were involved in that incident.
And to add to that, the contact that Erin is talking about, because there were multiple cases at School 29, there were 8 Department of Health completed their contact tracing. 5 of them were determined to not be related to each other or the building at all. And then there were 3 that were among staff, and that interaction took place when students were not on site. So that's just something that we wanted to share as well with the completion of that. And there were 0 positive students as a result of that case. And School 29 has only had 4 positive students in total. And that was all during the months of, I think it was November and December to each month. So there were no cases at all for students. And again, the staff ones were fully investigated by Department of Health.
Thank you, Stacy. And the $1 million question, as we are coming to a close for our RCSD staff, is, do you think that schools will fully reopen by the end of the year?
The end of this year?
Yes.
No. I'll put myself out there and say no. That's not even, no.
Yeah, to kind of extend Stacy's response, I think we're still in the process of, with our budget process as well as our academic plan, still finalizing what we're going to be doing starting in the fall of 21. So the plan we currently have in place is the one we're going to stay with until the end of the school year. But really our focus is now is what will September of 21 look like, and actually what will the summer of 21 look like, because that's really our next academic phase is some elementary and secondary programs for our students in the summer. So that's actually the first step. Got a little bit ahead of myself, and then simultaneously the planning for fall of 21 is ongoing as well. And there are an awful lot of variables in that we don't control, that the doctors have kind of really discussed today, the vaccination, implementation, and some of those other items are really going to affect our final decision making. We've been incredibly blessed to work with the Monroe County Health Department and have their insight all along the way. And then we also have the great benefit of working with our colleagues in the suburban schools as well. So we're all kind of in one step in terms of moving forward, because our kids, all the kids in Monroe County need the same opportunities. So we will also be in alignment with them. And my hope is that we're all back in 2021. It's been very lonely here for the past 11 months. So the more people we have around me, the better off we are.
Yeah, and sorry for being so kind of blunt about that. It's just we have to make sure all of the safety is there prior, and that's really important. So even with, as guidance changes, as everyone talks about, things change literally daily. The thought behind all of the people who do what all of us do is that getting every single person back in this building by June just isn't practical right now. Now, if some miracle, and that's what it would have to be, occurred, maybe, but not with what we know right now.
Thank you, Stacy. And don't go too far. Just wanted to pull out a follow-up question in regards to notifications. And as we are going through this process, we're learning to grow as we go, certainly making sure that safety remains our top priority. So when it comes down to positive tests in school, can you just kind of explain the notification process that parents receive when that happens?
Sure. So when the district is notified of a positive case through any number of ways, sorry, I lost my train of thought there. So we're notified through any number of ways. Either a student or staff member goes home ill, and then they see their physician, and then they report back to the district. The Monroe County Department of Health provides us with positive case information, or a parent calls or a staff member calls because they've been out and they found out that they were quarantined and then become positive after. So those are all the kind of different ways that we find out. Once the district knows that someone is positive, we do internal contact tracing, and we send all of the information to the Department of Health. They do contact tracing as well. And then we notify the day that we find out. Typically it's the day and when I say the day, sometimes we find out at 10 o'clock at night. So sometimes it might be the next day that information goes out to families of any on-site case and staff members. In that notification, we indicate the day the date the person was on site last. And we think that that sometimes is confusing for people. So I just want to take a second to talk about that. So that means that if we have a hybrid student who only comes to school on Monday and Tuesday, they might not have been on site since the 5th of February. I'm looking at a calendar because, or no, I'm sorry, the 2nd of February. They started to feel ill on the 4th. They went and saw their doctor on the 7th, found out that they were sick, that they did have COVID. We find out on the 8th. So we would send out that notification on the 8th that the person was last on site on the 2nd, right? So people say, oh my gosh, you've known since the 2nd. And that's not the case. We're just letting you know that's the last date the person was here. And the reason why we share that information is because contact goes to when you last was, if you were with that person when they were infectious as well. So that's why that data is shared. So I did want to share that. So to summarize, the notifications go out basically as soon as we receive them. And for anyone who's on site, and it's a robocall to the parents, and it's a letter email to staff, and all of that information is also on our website via letter for every case. I think I got everything, Erin. Do you have anything to add for that one?
Nope, I think you did great.
Okay.
Thank you, Stacy. So we have 2 questions left, one for RCSD and one for our U of R team. I'll finish up with just our RCSD staff. What happens when the parent cannot be located to pick the child up when they are called?
I can answer that. Oh, go ahead, Mike, if you want to answer that.
Erin, I'll follow up. You go. If you answer it, it'll probably be much more correct than if I answer. So why don't you go first, and then
yes. So we exhaust all options and all phone numbers to try to get a parent to pick up that student. We do have had situations where it's taken some time and the student is in the isolation space with an adult. They can do work just like if they were in the nurse's office. Most of them don't feel too sick. In some situations, we reach out to our transportation department and they can provide us with a sick bus to help get that student home.
Khadijah, I'd be really remiss. The sick bus, by the way, is not a green bus. It is still a yellow bus. So there's a little bit of, they think it's some kind of magical bus. It's just, we'll make sure that, most important, we can make sure that the child gets home. I'd be really remiss every time I have a public opportunity to recognize, at least internally, Stacy and Erin. People have actually no idea the amount of time and energy and effort that goes in behind the scenes to not only be proactive with all of our policies and procedures, communication, meeting with teams of teachers and parents and students and so forth. And then on the front end, and then on the back end, tracking literally hundreds of different variables of positive cases or possible cases, trying to do some initial contact tracing. I mean, these 2 have been absolutely unbelievable. And I'm on our team, there are no days off. I mean, this process goes 7 days a week. They both work Christmas Day, Thanksgiving Day. I gave them New Year's Eve off just because I figured we had to do something for them. But in all seriousness, this is just a tremendous undertaking. And our community, our school community, our community would not be in the position that we're in without their efforts. So I do think they really, whenever possible, I want to make sure I do that because they're just absolutely incredible. And they really make it look easy, which is a credit to their talents. But that really is important for us to continue to recognize people like this that are going way beyond. They both have families at home and with young kids, so there's a lot of pressure points here, and they never waver from their commitment. So I want to make sure I thank them.
Thank you so much for that, Mike. It's kind of like a perfect wrap up for our last question. This pandemic has been extremely stressful for everybody involved. We're very, very thankful to have the relationship and the partnership with our the University of Rochester, as well as our dedicated staff here, part of the health and safety team with RCSD. The last question as we wrap up this session is for our U of R staff. What are resources available for students and families that may be having stress or other issues from the pandemic in school and in the community?
Do you want me to take that? I can. So yeah, it's so important because we've seen both sides of it, right? We've seen lots of kids who actually are happier to not be in school because some of the social stressors of in-person school are relieved now. And then of course, a lot of children who are missing out on so much of not being with their friends. And it's very different depending on how old your child is as well, and kind of what their expectation is and what else they're able to do with their time. So I think, this has been a huge year of grief for everybody, right? 2020 did not meet our expectations in any way. And so for parents, acknowledging your own grief, I think is really important too, for your kids to see that, I think it's very tempting. I'm a mom of 2 kids you want to kind of put on this like happy face and all this kind of stuff. But part of teaching children to be resilient is helping them work through all sorts of different struggles. And granted, obviously this is far bigger than any child has had to face, as a world, we haven't had to face anything like this in any of our lifetimes. So as far as concrete resources, your child's regular physician, whether it be family practice doctor or pediatrician, they have all sorts of support services. Some are within their own offices, or they can refer you to other services. And all of these services are available, not necessarily just in person, but they have various telemedicine or telecommunication ways of doing it. There's a lot of actually cool relaxation apps that are available, which I know that kind of sounds silly, but for the older kids, sometimes they like that. And just also kids really thrive with learning more information about how they can help, right? So many of us have just kind of felt out of control because everything has changed so much. And for kids, the younger kids especially, who really thrive on the routine and having a normal day-to-day activity or normal schedule, if you can kind of share with them the important information about what they're doing to help and to make things better, that can be really beneficial for them, to help them feel kind of goal-directed, that we are wearing our mask and doing a good job washing hands because it's how we can help to end this pandemic faster, instead of kind of taking of like, oh, this is terrible, we have to do this. It's we have to do this so we can help take control of the situation. Kids do much better with that type of framing. But I'd say first and foremost, reach out to your child's regular physician if you feel that things have reached the level where they need some support services, whether it be counseling. There are some online support groups that are still happening, especially for the teens as well. There are a lot of resources. It's the one area where the kind of flex to telemedicine has helped and has done very, very well.
And I think it's important too to just check in on each other. That we do that frequently here, that not everything is always what it seems on the surface. So checking in, it's like Dr. Murray said, it's okay to be stressed. It's okay, to not like the being out of your routine, but check in on each other. We're all here for each other. We all share these experiences together, and it's important to just keep that in mind.
Thank you. And so they put it back on me for the last question, but I would be remiss to say that from the district standpoint, whether it's in pre-K or in our from K through 12, our whole schools, first we ask that students reach out to their teachers, and they have a lot of resources. Liz Reyes, who unfortunately had another meeting, and with our counselors, we have counselors and social workers in the district. So to the parents, our first resource is to reach out to your individual teacher, who will make sure that our students are connected to the right help that they need within our staff. And then certainly working with colleagues such as the University of Rochester Medical Center, we'll make sure that our kids are taken care of and well, and techniques for stress that we all have been going through the pandemic. Again, on behalf of the Rochester City School District, our URMC panel, we thank you so much for everyone taking their time to, again, this is another opportunity to inform our parents, because when we are informed, we are all better off. Certainly, we probably didn't answer every question, but we did the best of answering what we could. And again, with COVID, it is a beast that is certainly, right now, it's getting better, and we're thankful. It is not over, and it is changing rapidly. But again, as a district, we will communicate as much as we humanly possibly can to our parents so that they're informed to make the right decisions, so that when their kids are in school, they are safe and they are safe overall. So again, on behalf of the Rochester City School District, Superintendent Dr. Leslie Myers Small, we thank you for another opportunity to come before you.